The majority of disability service providers surveyed by their peak body is concerned about the government's preparation for the full rollout of the $22 billion National Disability Insurance Scheme, due to start in July next year. This week, the Peak Industry Group surveyed 424 providers. Two-thirds of them said the government isn't responding to their requirements or cooperating with them on some of the issues flagged at the trial sites for the NDIS. Libby Hogan prepared this report.
NDIS is not just more of the same on a bigger scale. It's a very different approach to disability service support. NDIS is exactly the right destination, so it's where they want to be heading. They're sort of cautiously optimistic about the future, but they're very concerned. The road to get to their destination is unclear.
That's Ken Baker, Chief Executive of the Peak Industry Group for Disability in Australia. He's been monitoring the National Disability Insurance Scheme rollout, and this week he released a report in which 424 disability service providers were surveyed, and nearly half of all respondents said they experienced difficulties in recruiting staff. One of the service providers in the New South Wales trials cites Northcott CEO Kerry Stubbs.
So at Northcott we've already experienced difficulty in getting staff in some particular areas, rural and remote areas, allied health staff, and staff to help with particular groups such as Indigenous groups or people of non-English speaking background or CALD communities. But not only do we need more of them, but we're also asking them in many cases to do the work for not enormous amounts of money. And we're restrained from paying as much as we might like to by the price that the National Disability Insurance Scheme sets on provision of services.
Chief Executive of the Peak Industry body, Ken Baker, says the wages need to increase for disability support workers to attract more to the sector.
The risk there is that if the price isn't adequate, then the quality of the service won't be adequate, and the choice available to people won't be there because providers just won't be able to survive if they have to provide support at that price.
He also says workers could put people's lives at risk if there is not proper specialised training.
It is critical that workers have the skills they need to support people with disability, and people who have complex needs, high support needs, those workers require very specialist skills. So the investment in training is critical.
Another issue is disability providers are struggling to plan for the full rollout because the National Disability Insurance Agency hasn't coordinated with them and released market information.
I would have liked to have seen the operational plans published to give a bit of a greater understanding of the numbers of people for example, in Victoria under the bilateral agreement. I understand those won't be made public, but it would have helped to understand, well, how many people will be coming on in different geographic locations to enable providers to prepare and understand what the demand might look like.
That's Jennifer Fitzgerald, CEO of Scope, a disability service provider in Victoria. At the moment, they're planning in the dark, working off their own projections.
That becomes quite a complex exercise then, because from our perspective we have mapped where our current clients are by postcode. We've looked at the national disability data cubes to try and ascertain, well, how many people are likely to be eligible.
Ken Baker agrees.
Look, one of the founding principles of this scheme was a principle called co-design. It meant that government officials would work closely with people with disability, closely with their families, closely with service providers to build this scheme, design this scheme, learn from the experience of people in the trial site. And I think there's a feeling among service providers that that's not happening enough.
Ken Baker, the Chief Executive of the NDIS Peak Industry body.